This is a question based on microarray technology. So PAM is a microarray technology involving how many gene study. So let us first try to understand the concept of microarray study. Now what is a microarray study? It's a very important topic. Now let me tell you one very small thing, that what is the toughest part of any cancer treatment? Answer is not the oncosurgery. It's the post-surgery management where the patient has to accept radiotherapy and chemotherapy. Now when you talk about chemotherapy, there are a lot of complexities associated with chemotherapy. So there was an argument, can't we do away with chemotherapy? And the answer was no. Because we know that chemotherapy is going to kill the distant hematogenous tumor cells which have actually migrated out from the tumor domain. So someone said that, sir, if we give chemotherapy, what advantage will we have? Answer is the recurrence risk is reduced. So someone said, sir, if we get to know whether this tumor is having a low recurrence risk, high recurrence risk, then can we avoid? The answer was, how will you get to know? The answer is microarray. Micro means small and array means error. So microarray actually, it is the study of small genetic structures. So the study of the genes associated with any cancer to estimate the risk of recurrence. So estimate the risk of recurrence, and this is very important. This is remembered as RRC. Now for any patient, if RRC is low versus RRC is high, so if the risk of recurrence is high, then you have to give chemotherapy, and if it is low, then no chemotherapy. Now this is nowadays used for colon very commonly. So for CA breast, the first very important thing is inclusion criteria. Now what is the concept of inclusion criteria for CA breast? Answer is, they are applicable if the patient is a patient of, you can say, ER positive, ER/PR positive status. The second thing is the lymph nodes should be negative. So a lot of technologies that we have. The first is Oncotype DX, which is a very popular, and this is 21 gene study. So this is a 21 gene study. Then we have MammaPrint. MammaPrint is again a very important one. This is 70 gene study. Then we have predictor analysis of microarray technology, PAM, that is asked in the question. It's a 50 gene study. Then we have Oncotype I've discussed, EndoPredict. When we talk about EndoPredict, it's a 12 gene study. And then we have one more. What is that? We have GGI. What do you mean by GGI? It is genomic grade index. So genomic grade index is GGI, and this is 97 gene study. So these are some important things that we have to understand. Remember, for CA colon, what is the concept for CA colon? What is the concept of this? The very simple thing is, the inclusion is T3 or T4, that is into the muscle or outside the serosa, N0, M0. So these are the patients who are actually given chemotherapy. T1, T2, N0, M0, they are not given chemotherapy, but they are given. So for them, you can go for Oncotype DX. So you have Oncotype DX for CA breast also, and for them also. This is actually better known as Colotype DX. And Colotype DX, remember 21 is for breast, and imagine in exam you went remembering the Oncotype DX for CA breast and it was asked as Colotype. So ये तो उल्टा हो गया ना, just reverse that value. So that becomes a 12 gene study. So just reverse what you actually remembered. So 21 becomes 12. So let us go with this question, and the answer for PAM is 50.
Subscribe and press the bell icon so you never miss an update from PrepLadder.